GOAT participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today we have a very special guest with us here in the series of Meet the Speakers here at Gold Learning. And I would like to welcome Professor Dominic Wilkinson. Hello.
Hello.
It's so nice to meet you and have you here with us today.
It's a pleasure.
You will be presenting for our Gold Neonatal Online Conference coming up here. And we will be talking about the presentation you will be holding for us in June 11th. But before we jump into the topic, can you introduce yourself to our listeners? Let them know a little bit about yourself and where you're located in the world.
Sure. So my name's Dominic. I'm a consultant in newborn intensive care based in Oxford in the UK, though listeners might pick from my accent that I've also spent a lot of time in Australia. I initially trained in newborn intensive care in Melbourne in Australia, but my professional and research interest during my training was in ethical issues, and I subsequently did a PhD in Oxford in the UK in ethics and philosophy. And in recent years, I've moved back to work in Oxford, where I work half-time as an academic medical ethicist and half-time as a specialist in newborn intensive care at the hospital here.
Well, thank you for sharing that. So from what I've read in your bio, you have done extensive research and writing on ethical issues regarding the neonate in the NICU. How did that become a particular interest of your studies and your research?
When I was training in newborn intensive care, there were lots of fascinating and interesting scientific questions. But the questions that I found most challenging and to some extent most interesting were the questions that science couldn't answer, but the
Hmm.
questions that those who work in newborn intensive care have to grapple with very frequently, the ethical questions. It's not about what we can do, but what we should do.
Yeah.
And so became very interested in thinking more about that. I did a master's in Melbourne in bioethics, and that led me down the path of further training in medical ethics. After my PhD, I wrote a book um, based on that research, which uh, tried to untangle some of the very difficult questions about disability,
Hmm.
predicting disability in newborn infants with brain injury, and then making decisions on the basis of that, life and death decisions.
You mentioned and you brought up that there is the sciences of what we can do, and then you mentioned the ethical issues and also there are legal issues, right? Mixing in with that.
And there certainly are, and uh, I'm not a lawyer or an expert in law, and it's very important for everybody working in newborn care to be aware of the laws that apply
Right.
in their area of practice. But the law doesn't answer all of these questions. Even if we know what the law is, there's a
Right.
further question about what we should do within the bounds of the law. And then, of course, there's a further question about what the law should be, because sometimes the law needs to be revised or needs to change in some way.
Absolutely, absolutely. Now, in your years of research, speaking of, neonates and issues in the NICU, one thing is that science has made it possible, and which is so wonderful that younger and younger neonates are able to survive. And of course, with that also come ethical question. Has that changed anything in your research, or have that influenced you in any way?
Well, you're right that often the first question that people ask me relates to uh, extremely premature babies and the borderline of viability and
Yeah.
where that line is or should be. and I've certainly written about that that question. Uh, but the ethical issues that we face in neonatal care and neonatal end-of-life care are not restricted to those very most premature infants.
Right.
They affect, sadly, also term babies, um, and so it's those general ethical issues that I'm going to be focusing on in this talk.
Right. So you're focusing on ethical issues. We also then have the human factor, for lack of better word for that. That means the parents, the caretakers. How does this all fit together?
One of the centrally important ethical considerations are the views and wishes of the parents.
Mhm.
So we now rightly think that these decisions are not just decisions for doctors and nurses and midwives to make. They're decisions for uh, us to make together with parents. Uh, but of course, then there are questions about how to make those decisions.
Mhm.
And you point to the effect on professionals of making these very difficult decisions. Um, and we all come to our work with our own background,
Mhm.
uh, our ethical values, for example, that might come from a religious background or from
Right. Mhm.
a secular philosophical background. We bring those to our workplace, and one of the challenges is how do we reconcile what
Mhm.
we're being asked to do with our own personal choices and what decisions we would make ourselves if we were in the parent's situation.
Mhm. Mhm. Very well put there. One thing I noticed, I'm a Florida licensed midwife here in Florida, and for keeping my licensure, I have to take training, continuing education training, and part of that is also ethics. And I have compared the training I'm getting, or that is, available to me, to some of my colleagues in other countries, and there are some slight differences. Have you noticed that? And I'm asking this because you mentioned you have worked in Australia as well as the UK, and in your research, have you noticed any differences that are like, difference from country to country?
Well, there are definitely different approaches to end of life decisions for newborn infants and also older children and adults
Hmm.
between different cultures and different countries. Uh, and some of those are quite subtle and others are much more striking. I suspect the approach to ethical decisions is pretty similar between the UK and Australia and the United States, though there will be some differences. But within each of those places, there will also be families who come from different
Yeah,
cultural backgrounds, and one of the challenges for all of us is how to negotiate those cultural differences.
absolutely. Now let's talk about the presentation. I'm very interested in that you will be presenting here with us on June 11th, and you're presenting on ethical issues in the neonatal end of life care. Talk a little bit about the presentation for us here.
There are perhaps three different main types of questions that people ask me about relating to ethics and neonatal end of life care. And the aim of this talk is to work through these three broad areas. So one of the one of the questions is about when it would be ethical to stop treatment or to withhold treatment and allow a newborn infant to die. What's our ethical justification and how do we know that we've reached that point? We're often conscious that in retrospect sometimes we've gone long beyond that point. But where is it the point that it might be ethical to stop treatment that's prolonging a newborn infant's life? What's what are the ethical reasons? And those relate to uh, questions of quantity of life, the chance of an infant surviving, how long they'll survive for, and also quality of life, those difficult questions relating to the future that's ahead for the child. So that's one group of questions. But of course, even if we think that we've reached a point where it might be ethical to stop treatment, there's then a question about how do we make that decision? Who makes that decision? I've mentioned already the idea that decisions are made jointly between professionals and parents. But what does that mean?
Mm-hmm.
Um,
Mm-hmm.
how do we think about uh, the process of decision, and furthermore, what happens when the different parties disagree? For example, when parents and professionals are not in agreement
Yeah.
about what the right thing to do is. So that's the second area of the lecture. And then the third area of the lecture will focus on the much more practical question about what, as professionals, we are allowed and not
Mm-hmm.
allowed to do. So if we think we've reached a point, we've reached a decision, however we've decided to reach that decision, but then what specific uh, choices are permissible? So those are the questions that those of us who work in end-of-life care in hospitals are familiar with. They're questions about morphine in patients who are dying, questions about switching off of machines, they're questions about stopping of different types of treatment. So we'll talk through and think through some of those questions. The aim of the overall talk is not only to help people to separate out and think clearly about these decisions, but also to provide some practical learning points, some things to take away to relate to their own practice.
Very good. Well, thank you so much, Professor Dominic Wilkinson, to sitting down with me here and answering some of my questions.
It's a great pleasure.
And we're very much looking forward to your presentation. And now to our listeners, the presentation Ethical Issues in the Neonatal End of Life Care is part of the Gold Neonatal Online Conference. This presentation will be live on June 11th, 2019. And for more information on this presentation and the other presentations in the conference, please visit goldneonatal.com. Thank you everyone for listening. Bye bye.